Because the world is poor and starving, go with bread. Because the world is filled with fear, go with courage. He actually taught me to be a physician and a healer better than some or more than some doctors, actually, than many doctors. And he was not a doctor.
Hello, everyone. This is David Spiro with another episode of HUMED, and excited to be here today. I got chills reading this essay, and very excited to have Dr. Bruckner on with us today. She's a fellow physician that works in the pediatric ER. She's also an incredible writer. She earned a degree of journalism from Northwestern University in Chicago, go Bears, and then she went on to get an MPH from Columbia in New York City, not far from where I grew up, and SUNY Downstate, which is even closer to where I grew up on the island of Long Island, and then completed her pediatrics residency at Boston Children's, also known as Harvard. And then for the last decade, she's been an assistant professor of pediatrics at the University of Colorado, where we know lots of people because that's where I trained there for general pediatrics.
Yeah.
Wonderful people there at the University of Colorado. And she practices as an attending in the emergency department there, similar to what I do at the Children's Hospital in Colorado. And she serves as a director of faculty well-being for the section of emergency medicine that really resonates with me as well. She's passionate about patient education and health literacy. She's a medical editor for pediatric care advice for Schmidt Pediatric Guidelines, and I was there when sort of that was created back in the 80s and 90s, holy moly, and a leading provider of pediatric patient education content in the U.S. and in Canada. Our friends from the North. Her essays have been published in JAMA, which we're going to talk about today, Academic Medicine, Academic Pediatrics, Kevin MD, Doximity, Bellevue Literary Review, and Discovery Magazine. She also co-edited the textbook Narrative Medicine, a guidebook to transforming hearts and minds, which I love that title, by the way. Most of all, but most of all, her experience as a patient with chronic recurrent cancer, a mother of a child with a genetic disorder, and a hospice caregiver for her father and grandmother have fueled her passion for humanizing medicine. And part of that really led into her, or inspiring Julia to write this beautiful essay that was published in JAMA in February of this past year, which for those of you that don't know, JAMA stands for the Journal of the American Medical Association, is one of the top 3 well-read journals in the world. So no small feat to get published in JAMA. Julia, welcome to the show.
Thank you so much for having me. Thanks.
Yeah, it's really an honor and pleasure. And as I was telling you before, I reread your article today and just gave me chills because this is part of my journey, which is unveiling the human side of medicine through this podcast. And when I read your article, it really inspired me and touched my heart, as many of the listeners, because there are comments you can write in the JAMA platform.
Mm-hmm.
Many people were moved by your essay, and I assume you've received many emails as well from that. So I want to turn it over to you, and I would love to hear a little bit about what story you want to share with us today.
Thanks, David. I'm so appreciative to be here, and I think the work you're doing is so important. We need humanity in medicine more than ever, and so I'm really grateful for this time and to get this opportunity. I think, the story I'd like to tell today is a story really about my relationship with my father. I think he actually taught me to be a physician and a healer better than some or more than some doctors, actually, than many doctors. And he was not a doctor. I just think he taught me bedside manner, and he taught me how to be an advocate and a lot of the values that I hope I try to bring to my own practice and that I think really we need to reinvigorate as much as we can in medicine. So many people are already doing this amazing work, but in the face of, our culture right now, the politics of right now, our healthcare system that, you know, bringing the kind of values of service, of humility, um, of advocacy, and of being a witness to suffering. That's a huge part of what we do every day, and witnessing is important. I think my father showed me that, and when you witness something, you often then become a natural advocate. A lot of suffering we can't prevent, and the end of his life was sort of showed that. He had an illness that really there's no treatment for, there's no known prevention for, and that's what ended his life. So much suffering we can prevent, right? So I'm always trying to ask myself, what do we do about preventable suffering? And then what do we do when we have suffering that we can't do much about, that we can't prevent? And so that's sort of I think the lessons that he taught me throughout his life and our relationship.
And he was in his training was in the religious world, correct?
Yeah, exactly. So he was sort of the least religious leader, like the least religious leader I've ever met. And I say that sort of in a complimentary way. I think he really was a humanist, and he had a great skill for connecting with all kinds of people and really focused his work, being amidst and among all kinds of people, and wasn't the kind of, looking down from the pulpit type of religious leader. He had a lot of jobs before he became a minister. He, grew up in the 60s. He was quite the hippie. He, spent time in like ashrams in New Mexico, and he was a forest firefighter in Alaska, and he was an oriental rug repairman, and he drove a school bus, and he was a postman for, the US Mail Service for a while. He did a variety of things. I think he was a roofer and a painter, trying to find himself and figure out his way in the world, and I just earned some money. And I think those experiences really grounded him. He was always kind of just sort of a regular guy in a lot of ways. And then he ended up deciding to go to seminary at Union Seminary in New York City, which is sort of unique in that it's very like ecumenical. There are like lots of different denominations of Christianity that are educated there, and also they have a good partnership with the Jewish Theological Seminary there. So it's very ecumenical, right? And a lot of people learning from each other, and so I think that's a big influence. It has a huge social justice focus as well. And so that's sort of the context of which he was a Presbyterian minister and very progressive, um, very kind of in the community on the streets kind of guy. Um, I think I bring that up in the essay. He had this literally the office in the last church that he served, which was in Pelham, New York, right above the Bronx. Because Dave and I we're fellow New Yorkers, which is sad. He had like literally this very picturesque office, and this sort of stone building with very ornamental, working fireplace, and in the office, and the bookshelves lining the walls. It was very beautiful, but he really was usually not there. So he was usually out in the community, very often at the firehouse. He served as a fire department chaplain throughout his whole career of, more than 30 years. And he wrote his sermons often at the Dunkin' Donuts. So I think he felt comfortable being in more simple spaces than some of those more lofty ceremonial spaces, which is kind of cool. But
I just recalled, and maybe I'm off because I'm Jewish, but I have read a little bit about the New Testament, and I've read a bunch and about the life of Jesus from what we know. And was Jesus not or was he reported to be a carpenter,
yes,
of some sort of tradesperson before he became a leader in
yeah,
exposing the values that he wanted to expose to others and share with others. Is that true?
it's true. Yeah, I think Joseph, his father, was a carpenter, so I
Mm-hmm.
think that was a time when you kind of did the family business, and
Mm-hmm.
he was also, kind of barefoot in the streets, uh,
Mm-hmm.
kind of guy. I don't profess personally to be a Christian. I still think of Jesus as sort of a great model of how to live, um, and I think my father, saw it in that way too, sort of plus. But you're right, yeah. My
So I
father
want
was
to
not even a
take
carpenter, but he could definitely repair an oriental rug, which is sort of a niche skill,
wow.
and always
It-
taught us too that, and this is in a lot of the, like, ancient traditions of rug making, right, in Iran and Afghanistan and these places that make these beautiful rugs, they purposely always put a mistake in it,
hmm,
the
that's
handmade rug,
interesting. That's interesting.
right, to note that we are always imperfect.
Yeah.
And so there's a humility in that I think that I always appreciated, and so when he was repairing them, he just learned from an older man, and he still, even though he did that in his 20s and for a few years, he still had his little repairing kit that he would keep with
Hmm.
him, and, even when he was, like, 50, in his 50s, someone, if somebody needed a little repair on their rug, he would offer to do it for free.
So, Julia, you started your essay with talking about the idea of giving bad news.
Mm,
If I might read a little bit because it really inspired me and I relate to it. You wrote, "I dread telling someone that they have cancer in the emergency department. It's always hard. The walls are an odd pale yellow. The bed is uncomfortable. All is illuminated in harsh fluorescence." And then you wrote, "I try to soften it. I shut off the wall switch and turn on the warmer procedure light. You sit. I speak slowly, quietly. My phone rings. I silence it, but it rings again. And then you have to leave the room."
mhm,
You had shared something that is really moved me earlier in this conversation, which is he was a witness to suffering, your dad, and we witness suffering all the time in our
mhm,
work. So I'm wondering if you could talk a little bit about that, about uh, what about the witness of suffering and what you learned from your dad
mhm,
around that um, helps you be a human. And because that initial discussion is so vivid, it's real. It's almost an inhumane environment that we have to give
mhm,
bad news
mhm,
around, but yet we're forced to do it, and then we're torn in different directions. We have a patient in room 9 and a patient in room 18, and the nurse is calling us, and bells and whistles are going off all the time. So, can you share a little bit about this idea of being a witness to suffering and
mhm.
what your dad taught you about that?
It's strange work that we do, right? Um, we we are privileged to enter into these, like, the worst days of people's lives often, right? I don't know, I've told a lot of parents their kid has had cancer over the last 15 years, right? I'm sure you have too. That being just one example of, and it's often unexpected, right? They usually don't come in thinking that's what's going on. And we have to, and we've just met, right? I don't usually have a relationship with them. So it's very particular, I think, in our world of the emergency department. We're seeing these sort of sudden traumatic events that we're a part of, right? We're either helping take, well, I mean, we're helping take care of the person, right? Which is sort of I mean, we are able to do good often, but sometimes, I mean, like with that instance, right? We're sort of giving people news and then handing them off to another care team that's going to be with them. And we're having to tell them something so devastating with very little relationship or warning. And exactly, like, I've always thought about that. The ED it's even in the pediatric ED where we, like, really, I think, try to make it cuter and nicer, you know? It's like, it's a pretty, like, unpleasant, environment, you know? I mean, it's very technical, it's very, you know, it has to be sanitary and all these other things, right? And it's not like you're in a therapist's office where there's, like, a nice couch or things, you know? So how do we sort of create a relationship quickly? How do we create a sense of safety? And how do we sort of, yeah, try to soften that news? And then how does it affect us as we watch this family go through this? Like, I think it's just really, really hard. And I know we talk about giving bad news in med school, and we learn some of, you know, we learn about it and we learn the right things to say, and that can be helpful. And we have our colleagues in palliative care who I think are just amazing at this and teach us every day how to do it better. But just sometimes it's like ripping off the Band-Aid, like, it's there, you can't always make it so much better, and there is gonna be suffering, and part of that is what we can feel like we're creating it, right? Like, I'm the one telling you this terrible test result that means this. Like,
Mhm.
I can't change that. So, I think what I've learned most from my dad is a lot of witnessing is being and not doing, right? Like, I always think about that tension we have in our practice. Like, we're doers, right? We're like, we're gonna order the test, we're gonna, like, think about our differential, we're gonna use our brains, we're gonna use our training, we're gonna try and figure out what we can do, right? We're gonna diagnose you, we're gonna treat you, we're gonna suture your wound, or we're gonna, you know, set your broken bone. A lot of those doing things are more simple. But sometimes we just have to be, I think. Um,
And when
so
you
I
say be, you mean just be present.
be present,
Just
be with,
listen and
be
just
amidst, right? Like,
mhm.
and recognize, like, we are all human, we are all vulnerable. Like, this could happen to me too. This could happen to my child. So how do I, you know, how do I sit with someone? I think of, like, the great practice of sitting Shiva, you know, in Judaism with that's like a lot of it is sitting, right? Like, it's being, it's eating, right? Eating is important, I think.
A lot
I
of
grew up,
eating.
you know, I grew up around, like, Jews, Italians, and Mexicans mostly, and, like, the power of food, right? Like, in grief and in suffering is I think missing in some in some other cultures, like, and I very appreciate that, right? I don't bring in, you know, the bob cut to the ED exam room with the leukemia diagnosis, but sometimes I wish I could, right? Like, I bring Gatorade and goldfish, like, when I can, right? But so I've found that after speaking the words, like, time and some silence, and sometimes if it's appropriate, like, some hand holding or some, you know, hand on a knee or some, I don't know, you know, that time is important. It's also weird to get that news. I've gotten that news personally, like, I've gotten a cancer diagnosis personally, and what your brain does in that moment is very strange, and everyone has a different experience, but having talked to a lot of people who've gone through this, right, it's time becomes very strange and surreal, and it's hard to sort of, there's sort of a shock moment and a sometimes you know, like, you feel like in, you know, in Charlie Brown when the adults talk that, like, "Rah, rah, 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 rah." So I think some time also and sitting with, give some space for that to sort of settle.
Mm. We had a guest on a few episodes ago, Dr. Josh Daly, who is battling a craniopharyngioma, and he um, shared a lot of his journey. And one of the things that he shared with me that really meant a lot to me was he said that words, just sort of the standard words you say, were not so important to him,
Mhm,
but the being authentic and being emotional with him meant more to him than just sort of those words. Almost really the sage wisdom that you're giving now in terms of being present. I'm
mhm,
curious. You had mentioned in the article about your own
Mm.
cancer diagnosis, and then you also mentioned in the article your child has a genetic disorder. Do you bring that to work every day? Do you is there a part of those journeys that you've had with your child's medical
Mhm.
experiences and your own medical experiences? Do you think that's made you a different kind of physician?
100%. Yeah. I mean, I think it's just it's harder for me to separate myself from patienthood, and I really try to remember that my patienthood and my child's patienthood and my experience as a parent is not the same as anyone else's. And everyone does their own journey, and we all have our own burdens and our own processing. And so I don't, but I do think it brings a different level of empathy that's hard to fake, if you haven't gone through that. Um, it, I know what it feels like to have a lot of procedures. I know what it feels like to have certain news given to you. I understand a little bit of sort of the process of things differently. And so, yeah, I do try to help that inform what I do while recognizing like the uniqueness of each person's situation. I do think it's made me more thoughtful about how I speak to people and how I listen to people, and kind of getting back to what you said you know, uh, about Dr. Daly's experience. I listened to that. It was very interesting, very moving, and it resonated a lot with me too. And um, that, people get uncomfortable with bad news and with seeing suffering and uncomfortable situations, right? That's pretty human. And sometimes what we do is we try to talk around it. So we say some things that are well-meaning and come out strange. So I've heard a lot of that. Oh, like this is meant to be, or, there must be a plan, or and a lot of that is it's strange. And I understand where it comes from. But usually just not talking is better. It's hard for us to not talk as doctors.
Oh, I know. I know. You had also shared the fact that you were part of the hospice environment for your dad and for your grandparent. I'm wondering how that did that change the way you are as a physician, witnessing and being part of the care at the end of life? Because we take care of children, which is pretty much at the beginning of life,
Mhm.
and with hope and different energy. And I had written an essay in JAMA about spending the last couple of weeks with my mom
Yeah,
in her life, and it was horrific in terms of my experience, and actually got published in JAMA, and
yeah.
not good. But it sounded like um, there was an inkling with your dad's passing that there was some peace to it. Can you talk a little bit about what that exposure was like? Because
Mhm.
hospice is at the end of life, and we as pediatricians are at the opposite end.
Exactly, and I mean, thankfully, right, we don't need to deal with end of life a lot, because that is,
Mm.
I mean, that's a particular kind of tragedy, right? Talk about suffering. Oof. That's like a biblical level of tragedy, I think, losing a child. It just seems so out of the unnatural. It seems so unnatural, right? It's like out of the order of what we expect in life. I'm really grateful for hospice as an entity, and I'm grateful that, like, I've had both my maternal grandparents were on it. My my maternal grandfather died when I was a teenager, and he was on hospice for years, actually, and that was sort of my first experience with it. And he was at home, and that was the first experience I had with watching somebody die. Um, and it was actually like fairly spiritual for me. I think he had CLL, chronic lymphocytic leukemia, and that's sort of a prolonged illness. And then it sort of it does this thing called a blast transformation that many people know, where it sort of gets more aggressive at the end. It's a blood cancer. And so he got quite sick, and he looked like a kind of a living skeleton. He just looked very ill near the end. And when he finally took his last breaths, I sort of felt and saw like sort of an energy or spirit leaving the body, which was surprising and different for me. I haven't had that experience really again personally, but, um, my maternal grandmother she died at 90. She had a very healthy, active life, and then she started falling, and she wasn't really telling people about it, and then she had a very bad fall and was in the neuro ICU, and there was really nothing to be done, and thankfully, I was already an attending at that point, and I knew enough about the system to sort of say, "Hey," like, they were gonna transfer her to, like, a step-down unit, and I said, "What are we do like, are we doing anything there?" You know? I mean, I think that's a privilege that we have as physician family members, right? Like, we we can say, like, "Can we just do hospice? Like, let's just," you know? 'Cause my no one else in my family is really in medicine, and so I was able to kind of, I think, take some of that role and say, "Let's get her home." And so she had 2 or 3 days at home. And it was kind of beautiful because we were all there as a family. We were able to, we decorated her bed with like scarves and, we played music and she had, her brain was not right. And she was doing a lot of singing actually in her last days. And we were singing together and we were looking at old family
Mm,
albums and she was the first time I understood how death is the process of death, right? Like even in training, it's rare that we're at the deathbed for any prolonged period, right? Especially in residency and as attendings, like you pop in, right? Like you pop in to do certain things. You pop in to like, see how somebody is doing in the process. You're not there to see the whole change. And then you go in to declare death. Our nursing colleagues are know this much better. They're at the bedside much more. So it was interesting to see how, like birth, death is really a process with stages, and I hadn't seen that, watching her fingernails turn a bluish gray and
mm,
seeing the changes in her breathing and seeing that process, and thankfully, I was able to be there to give her medications to ease her discomfort and her, her air hunger and things like that, and she we were all looking at she had, her old family photo albums from her and my grandfather's honeymoon, with the little pictures on the black paper
mm,
with
mhm,
paper corners and of them so happy. We were all really looking at those and laughing, and that's when she passed. Um, my father had about a week on hospice. He died it was during COVID, so he had frontotemporal dementia, which is really I would not wish that on anyone. As I say in the article, it's, the one thing I remember learning in med school and being like, "Oh god, that is a horrible illness." So, it's a kind of dementia that affects your frontal lobe, which really affects your behavior, your personality, your impulse control, and it's progressive over years. For him, his symptoms probably had started about 8 years before, but they were subtle, and they didn't really become more apparent until the last sort of 2 years or so of his life, and he started having some seizures, and his speech became strange, and he had been this very emotionally intelligent, high very witty, always telling kind of some smart but sort of groany puns, really wonderful with people, and he turned sort of into this very rigid, almost like sort of almost with features of sort of like a person with autism, you know, very repetitive, very routine focused, very trouble, he ate a lot of sugar. He, like, smoked a lot of cigarettes, like, he did, he walked obsessively, these really kind of odd behaviors. Sometimes they were kind of amusing in the like, sometimes you have to laugh instead of cry, and my kids were like, "He's kind of like Elf, he's just, like, dumping all this sugar on his cereal," and, like, like in the movie Elf. I'm like, "Grandpa, that's too much ketchup, or that's too much sugar," you know? But it was really odd to see someone, who had been so different than that become that way, and it was really kind of strange how powerful the brain is and isn't when it doesn't work right, and so this was during COVID, and he ended up needing to be hospitalized because he was getting too sort of like he was walking into other people, like walking to other people's homes and asking for cigarettes. He was crossing the street and falling and almost getting hit by cars. He was getting unsafe. So he was hospitalized. And this was during like kind of the mid to late portion of COVID. So, there were still a lot of restrictions. He kept trying to escape from the hospital. He needed a sitter, but there weren't really enough staff in the hospital. And my mom could only be there so much times per day. It was very challenging. And honestly, I think that he knew enough that he knew that he did not have any quality of life anymore. He had visited people in nursing homes and care homes his whole career. I mean, that was his witness to suffering, right? He did a lot of sitting with people at their deathbed and when they were racked with dementia and they didn't know who anyone was. And And I think he knew he didn't want that. So my mom and I think, and my brother and I think, we were all sort of there in various ways near the last month, and that he knew enough that he basically like went on a hunger strike and stopped eating and stopped drinking and knew that that would lead to his end. And so again, the hospital is trying to place him in different facilities. And I think my mom was very hesitant to do that, especially because there were so many restrictions on seeing him during COVID. And he'd lost significant amount of weight and was really not eating, not really, voiding or stooling much anymore. And so I said, I think he actually qualifies for hospice, which was correct. And he had a wonderful care team at University of Rochester. He had a neuro palliative care doctor and a great neurologist who was more senior and experienced. And I think they said, yeah, let's do this. And I think that we knew that's what he would have wanted, even though he couldn't quite say it. He had talked with my mom sort of about some of those wishes. And so we brought him home. He ate some cherry pie that my mom made, which was his favorite food. And that was the only thing he ate. And then we had like a hospital bed in the house, and he died about a week later. And I think that was the best way it could have gone. And so I think that, again, like, that was not preventable, like, that suffering was gonna happen. We could make some of it more comfortable, and I think that's the question we all have to ask ourselves, like, we're all gonna personally be faced with that face or experience that with our loved ones. So how are we, do we have the privilege to be able to make decisions like that? Like, there was a lot of privilege there, right? Like, we had insurance that would pay for the hospice. My mom there was actually sort of a service that provided almost like a death doula, like an aide that could come and be with my mom, so she didn't have to do all of the hospice caregiving herself. Um, and then I had the knowledge too to be able to advocate. So I wish that more families could experience that,
So your dad exposed you to something that also really resonated with me that you talked about in the article. Your dad took you to in engaging with the homeless people, and you described going to an outreach, being in an outreach van and giving out sandwiches and food, and you made this statement which I also resonated with, which is that you were doing something, but you weren't really fixing anything, but you were sort of just being with the people and sort of
Mhm.
providing them comfort. And that also resonates with me. And I don't mean to offend anyone that is an emergency room physician, especially pediatric emergency medicine, but I I want to say that I'm going to take a guess. 70% of the time, I know that's a high number, but 70% of the time, I feel like we're not really doing anything.
Mm.
Yeah, we'll do a viral test. Maybe we'll give antibiotics, but children usually get better despite what we do.
It's true. It's so
And
awesome about him.
but it's the process. It's not necessarily the outcome, but it's the process of just being with people. And um, in the ED, we give food, and we at Arkansas Children's, we see a 70 to 75% Medicaid population, so very poor, coming from urban and rural Arkansas.
Yeah.
And I often offer food.
Yeah.
I've talked in previous articles that I think the most important thing I do is give out food and popsicles and juice and things. And
Yeah.
there's something very powerful about that. And I would love you to talk a little bit about and then you had talked about in your article that you volunteered as a resident, as a sort of street medicine, giving out condoms and giving out hot chocolate and different things. And so I was wondering what your dad taught you about process more than outcome.
Yeah, exactly. No, that's exactly the way to say it, right? I mean, I think I teach all of our trainees and I try to remember myself, right? People come mostly to the ED because they're worried about something, and that worry can be anything. It can correlate with sort of their severity of illness or not in any direction, right? And a lot of what they're scared, right? And so I think a lot of what we do beyond the technicalities of the medicine and like, okay, what antibiotic do you need for your ear infection or not or whatever, right, is like addressing that worry, right? So I always ask, like, what are you most worried about? Or what worries do you have? And I try to ask that early on. Cause to me, like, if you don't address that, you're not taking care of them actually really fully. And then I think there's a comfort piece, right? Like, and I, right? Like, how can I just make you feel more comfortable in the moment? Like, that's part of my job too. So it's not quote, it's not below me to get you a blanket, right? Like, if you're hungry, I want to offer you some food, the famous ED turkey sandwiches, right? Like, we have goldfish. Popsicles are powerful, I mean, they soothe the sore throat. They hydrate kids in a fun way, right? We all know that. The Some of our nurse colleagues got in our ED got these T-shirts that says, the emergency department, we have the best popsicles in town. And I'm like, yeah, we do. So I think a lot of it's just those very human things, right? Like that's like very basic on the hierarchy of needs. Like we need shelter, we need warmth, we need clothing, we need food, we need water. Like let's start there. We need our pain treated, we need our suffering treated. That's where some of our technical skill comes in. But and that's, I think, right, in the face of like the overwhelming injustice and the problems you see, we see in the ED, right? Like we're the place that takes care of anyone, no matter what, like regardless of who can pay or where they come from. Like that's what I love about where we practice. That's part of why I chose to practice there, right? Like, and so a similar thing, like you're on the homeless van, like you can't give these people houses right in that moment, right? Hopefully your experiences can inform you and you can use your privilege and your skills to get toward that bigger goal, right? But what can you do in the moment? And so that's what the
Mm.
homeless, like it was very, very impactful for me growing up doing that. I mean, it was kind of cool because it was like in the middle of the night, so you're like 12 and I'm like, I get to stay up all night and go in this van. And I was living, on Long Island. And so we would drive into New York City. And what especially struck me is a lot of our stops in the van were like on Park Avenue, literally. Like there are people that live in the doorways of the churches on Park Avenue at night. And to see that insane wealth, like literally you're like across from the Louis Vuitton store and there's someone who's living on the street in a cardboard box. Like, what the heck, right? Like, talk about a lesson in injustice and class consciousness, right? And so I just remember feeling like, oh my gosh, what? But hot chocolate also helps, right? It's better than nothing. And my dad, he very much practiced his ministry and his healing in those environments. Like he helped run a gardening program when we lived outside of Philadelphia for death row inmates at a prison there. I mean, these are guys like that were on death row. I mean, there was no, right? Like I think of that sometimes, right, with almost like terminal illness, right? Like there's nothing that's going to change that situation. Like those guys are not like a lot of them, some of them maybe were unjustly imprisoned and that's a whole other story, right? But like most of them, like they know they're like, I did this and this is my punishment. But what can I do in the time that I have? And this gardening program, I think, to give them something to cultivate, to grow, to love. I mean, honestly, that's like love in action, right? Gardening, I think, to grow food, to grow flowers that bring beauty. Um, we did a lot of work with Habitat for Humanity and other similar organizations growing up. So we spent a lot of weekends, my dad and I, hammering. And I guess that's where the carpentry comes in, and building homes. And so to me, like I've never been into sort of religion in terms of the ceremony of it or the services or the garb of it, right? To me, it's like, it's love, like service is love in action. And that's what I've learned from him. And that witnessing, right, that we see every day too, right? Like that's why I think physicians, like we have so much opportunity to be advocates. We see so much crazy stuff, we see suffering every day. And so then what do we do about it, right? And that can be in the lab, right? Like the cancer I have, like the reason I've survived so long with it is because of research and innovation and scientists, and that's one way of service, right? But I also train in Boston with people that, started programs around like safe and healthy housing and, all kinds of other ways of sort of on the ground advocacy and bringing our practice outside the clinic or the ED spaces. So I think that's what I think about, like, yeah, what can you do in the space and the time that you're in?
So you also, I mean, there's so much to talk about about your life and what you've done and your dad. You also serve in a role that really is meaningful to me in terms of supporting wellness amongst your physicians and getting back to um, that comment from the beginning is we are all a witness to suffering. And
Mhm.
so part of what we talked about was how to be an effective witness to suffering and how to support patients. But we also, it's impossible in this role to not feel it and experience the trauma, what I call micro traumas,
Mhm.
all the time that we see, because there are many things we can't fix. You have a diagnosis of cancer, your child just passed away, and we witness these things. Um, 30 years ago, when I started my training, it was more about just deal with it, or we didn't really talk about it.
Yeah.
I had a co-resident that was suffering from depression, and
Mhm.
I don't think it was handled well
Yeah.
during my training. And so, what what about your dad and some of the wisdom he shared with you allows you to approach wellness? And what does wellness to you mean in the environment of the pediatric ER?
Yeah. No, it's a great question. And I mean, it's secondary trauma. Our jobs give us secondary trauma. It shouldn't be surprising, right? So I think
Hmm.
there's been this avoidance of it or this non-recognition of it. And to me, it's like, no, that's a part of the job. Like we know that's going to happen. So we got to prepare for it. We need to build systems and to create that. I mean, I think where I went to residency, the in the my friends who went on to do a pediatric oncology fellowship, right? Like there was a therapist that they had as a fellow and they had group therapy and there was all this built-in things knowing like this is going to be you're going to go through traumatic experiences. You're going to watch other people's trauma and it's going to affect you. It can you unless you're a robot, it takes something from you. It hurts you too. It's never gonna be the same as the pain that that family is going through, right? Like, I think we have to honor and respect that as separate, but we take a piece of that, and when we start to stop taking a piece of that and we build a wall and protect ourselves from it, then we that doesn't work either, right? That's when we turn it inward and we get depression and suicide and alcohol problems and all kinds of other things that we see, right? We have to
Which
find
is
a way to start.
very high in our field.
Of course,
Just to
yeah.
recognize suicide, we just had a unfortunate experience with one of our former residents who committed suicide, and so it's unfathomable to even think about it. And
Yeah,
but we physicians are very, especially emergency physicians, are at high risk of depression and suicide.
yeah, and just burnout too, and so and how do you keep that balance, right? How do you
Hmm.
keep the boundaries that allow you to do your job and without becoming a robot, and how do you, you know, it's tricky, right? So, I mean, my dad was a forest firefighter and that kind of in Alaska in the 60s or 70s, I think. I think is sort of where he learned this. And so he always had a passion for supporting first responders and firefighters in particular. And he actually was the fire department chaplain, of a fire station on Long Island when 9/11 happened. And a lot of the, a lot of the members of that community lost people in 9/11. And he was good friends with, one of the first people who died in 9/11 in the towers, who was one of the New York City Fire Department chaplains. Uh, who was an amazing person. And so, he resonated a lot with that. He was providing a lot of support sort of to the firefighters from all over the region volunteered to like help with the cleanup and the recovery of people who had died and things like that at the site. So, seeing that him go through that, and then just knowing like how people who do that kind of work, first responders, people who are seeing traumatic things and that other people are experiencing, need their own support. So, and he knew, especially, like, I think the firefighting community has a lot of similarities to us in medicine. There's sort of this like, oh, we're good, we're fine, we're tough, we can take it, and there's not a lot of room for vulnerability, and there's not a culture that accepts that. And I think that's changing a lot with this generation, this younger generation of physicians, certainly, and nurses. I think nurses have always been a little bit better at this, at being more vulnerable and supporting each other culturally. But so he would just hang out at the fire station, right? Like, he knew that they're not going to like come to his office and like make an appointment and like do, because it felt like therapy. And so he just hung out with them, and that would give the opportunity for things to come up and process. So, one of the things that we've done at our hospital that my colleague, Dr. Jenny Reese, has really pioneered is peer support. And so we have a very vigorous peer support program where people have some training in being there for others. Um, we've been working on our debriefing process related to traumatic clinical events in the ED, and including, sort of a recognition of the emotional impact in that moment, especially sort of in our hot debriefs, which happen like right after. Those traditionally are used to sort of discuss, like what went well, what could we do better, what are the technical issues of the like medical care we provided to this like child that we had to resuscitate, or things like that. But we've also sort of recognized like that's an emotional time too, and how do we deal with those emotions in the moment in the way that helps us regulate, recognize what we've gone through, recognize the great work we've done, the gratitude that we have for the team that we had and the skills we were able to bring to this child, and often incorporating a moment of silence as well. I think, one thing my dad showed me is people, we like ceremony as humans, right? I mean, he did a lot of weddings and funerals and baptisms, and these, mix of joyous and challenging, you know, things full of grief too. And ceremony is important. It brings us together as a community. It helps us process. So I really do believe that trying to bring small moments of ceremony, like both at the bedside with our patients, right, in whatever way seems right. And sometimes that is bringing food, right, or or with our colleagues. I just am hopeful that the culture of medicine is changing to recognize that more, and especially in our acute care fields of emergency care, of critical care, of surgery, that we're taking care of our people are starting to feel safe being vulnerable, and that we're starting to build systems and supports, peer supports, or therapy, access to therapy, or things that can, and we're able to talk about that with each other. And so we're not living in this sort of avoidant, denial, secrecy spot. That's never going to help us. And I mean, what a tragic loss when you lose a physician who spent so much time learning to care for others, and they take their own life. Like, that's just such a loss on so many levels. And it really, I think, is preventable. That's preventable suffering in so many ways. So we're failing. And as a profession, as a community, when that happens, I think we can do better to take care of our own.
It's interesting because for those of you that don't know, there is a process that most, at least pediatric emergency departments in the country, utilize, that after a child passes away, there's some structure to it, usually, where we talk about what went well and what did not go well. But I've always found that the most important part of that process is checking in with the team, because oftentimes I'll look around the room and there will be people who almost always, this is their first experience of a death of a child. And it's a very personal experience, but it's also a very communal experience. And I think it's a huge opportunity to reach out and discuss and name it, that this was really hard, and it may affect everyone differently, and what resources are available. And I've always felt, as a section chief in my division, when I hear of a passing, that was particularly difficult, I'll usually hear about it, and I will reach out to the attending or the attendings involved and say, how are you doing? I know this was a really difficult experience. We just had a recent drowning of an older child, and those are particularly horrific deaths because they're older children and they were well, and then there's a passing. And if you are a parent, even if you're not a parent, it affects everyone so deeply. And kudos to you and your colleagues for recognizing that. And offline, I'd really love to talk a little bit more about what you all are doing because I want to do more of it. I think that sometimes we focus on procedure, but really we need to be focusing on emotion and what we could do to be supporting each other in this communal experience that we all witnessed.
They're both important, but no, it's too long we've avoided the emotional piece because it feels uncomfortable. And sometimes I think we just have to say, and I say this with families sometimes too, like, this is just horrible, right? Like sometimes we just need to say that, like, this sucks. This is hard. Like there's not a way around it. We have to go through it, right? If we don't feel the feelings, they're going to go somewhere else and that doesn't work, right? And that's true for our colleagues. And you're exactly right. We had a drowning recently too. I mean, it's summer, right? Like I think I agree with you. Drownings are like a particular type of horrible and shock, and they're uniquely traumatic, I think, on the team that takes care of those kiddos too. And you're right. Everyone's going to experience it differently. I mean, especially, I think too, especially for our trainees, our medical students, our nursing students, our new nurses, our EMTs who often tend to be, young in their 20s. I think sometimes we need to really attend to them as well. And I mean, I thought about that once, like, that's the word attending, right? Like that's what we are when we're a grown-up doctor. And what does it mean to attend? A lot of it is presence and being with and checking in, just like you said. And knowing that like our whole careers, we're going to have our experiences with suffering are going to change. You're exactly right. Like as a parent, right, it becomes different. Like, especially if that child is a similar age to your child or looks like your child. And I think that's what Dr. Jerome, who you had on for organ, the organ donation episode, was mentioned when he took care of a child who was an organ donor, who was similar age and kind of personality and life to his child. And so that's a great example of that. Like it's going to be different every time. And so as long as we're aware of it and we talk about it and we know how and who to reach out to, I think that's going to be protective for us. And it's going to make us a better doctor, right? I think as a mom myself, like, I want a doctor that feels and who thinks about these things, right? They're going to be more empathetic. They're going to be more understanding. They're going to be more thoughtful. And that's what the practice in our practice is. We just need to set up the systems for it.
Well, this conversation has been particularly meaningful to me because in a week I'm going up. It's been 3 years because we're not traditional. I'm a secular Jew, but it's been 3 years since my mother passed, and for multiple reasons, we have not. Well, in the Jewish faith, we have something called an unveiling. So a year after the passing, we unveil the stone, and it's been 3 years. But I'm going up next weekend, my brother and I, and we have a rabbi coming to the stone, and we're going to say some beautiful words about my mom, and there'll be some performative Jewish blessings, which I'm have some mixed feelings about, but I think my mother would have liked that, and my brother wants it, so it's all good. And but I'm going to get to say some things that I've wanted to say, and it's going to be Father's Day weekend, so my kids will be there, and I think it's going to be a beautiful weekend, and we're going to spend the whole weekend together, which I know my mom would have really loved us to do, and the cousins will be together. But to me, one of the things that would be incredibly special as we end this podcast and as you ended your essay is to talk about this beautiful benediction that your dad had that really sustained my coolness of what I think about your dad and how seriously and how he lived his life was really that benediction is really because we don't really do benedictions in the Jewish faith,
Yeah,
but it really moved me, and I'm wondering if you would be kind enough to read his or speak his benediction to us as we end this podcast.
I would love to. Yeah, he would speak this at the end of many services. I also read it in my eulogy at his memorial. I'm so glad you're going to have that important time to memorialize your mom and to remember her and how she's living within you, all of you, right? I think that's the blessing we have from our ancestors. They live within us and we can continue their work and their love in the world, you know.
Hmm.
He wrote this. It's adapted from something that's in the Book of Common Prayer, which is a Protestant kind of religious text, but they are his own words. And to me too, this is sort of, this is all you need, right? To me, this is my religion, so to speak, these simple words. So I'm really honored to share them. I've gotten emails and feedback from other people all across the world that have read this article that this is what resonated most with them. And it warms my heart so much and it fills my soul. And I know that wherever my dad's spirit is, he's really happy that other people this is resonating with them. And I think he feels probably really lucky that these words are still here. So I will read it. Because the world is poor and starving, go with bread. Because the world is filled with fear, go with courage. Because the world is in despair, go with hope. Because the world is living lies, go with truth. Because the world is sick with sorrow, go with joy. Because the world is weary of wars, go with peace. Because the world is seldom fair, go with justice. Because the world is under judgment, go with mercy. Because the world will die without it, go with love. Hmm.
Well, I feel your dad
I do too. I'm
through
gonna
you.
get a little.
I feel your dad now. I feel your dad through you. And it's really been a huge honor to have you on the show. And this is what I'm trying to peel apart every time there's an episode, which is the humanity of medicine. And I've learned so much from your dad, from the article you wrote, from our time together here. And I hope our listeners will learn something from listening today. So
David.
thank you for being present with me. I felt present with you today, and thank you for all you do as a physician, as a mom, as a human being. Thank you for all you've done, and I hope I can have you back on the show again, because I think we just scratched the surface in terms of what I'm trying to bring about in terms of exposing the humanity of medicine. So
No,
thank
I
you.
love the work you're doing. I think it's immensely important. I feel so blessed and honored to be able to be with you. And yeah, I mean, I'm not perfect. None of us are perfect, but I think if we can just do our best every day and again, just, yeah, be a helper, like Mr. Rogers said, right? Bring love.
Yeah, Mr. Rogers, one of my favorites of all times.
He was a wise man. He was how I grew up. And like you said, just be a helper. I mean, there's so much in the world that needs to be helped. And if we can do our part within our little corner of the world, I think everyone can do that in their own way. And it would really probably make things better for all of us. So thanks for giving this space. I am so excited to hear more of your work and And thanks for being on the team and the work we do.
Mr. Rogers is, well, and was asked once about fame and what it's like to be famous. And he said, fame is a 4-letter word.
Yeah.
It's, so is love, and love is very important, LOVE. And so much is care, to care for others, CARE. And he just was able to articulate his thoughts and feelings about the world in a way that was so beautiful, just like your dad did at his benediction. And thank you for being here. A huge honor for me. For those of you that are listening, please subscribe. Listen to us on YouTube, Apple Podcasts, Spotify, wherever you get your podcast information. And I hope everyone has a wonderful day. Thanks, Julia.
Thank you so much.
Thanks for listening to HUMED with David Spiro, MD. If you like this episode, make sure you're subscribed on Spotify, Apple, or your favorite podcast platform. The video versions are also available on YouTube. Make sure you subscribe and hit the bell there so that you never miss a future episode.